Okay, I'm gonna dive right in. We do have 45 minutes here. Thank you everyone for joining the Seattle's Commute Recovery webinar. My name is Zarina. I'm a transportation specialist for Commute Seattle and your moderator for the next 40 or so minutes. Before getting started, I just would like to acknowledge that we are in the traditional land of the first people of Seattle, the Duwamish people, past and present, and we honor the land with gratitude. Just a few reminders for you all. We cannot hear or see you, so please post any questions you might have in the Q&A box. We'll be saving the last 10 to 15 minutes toward the end to answer your questions. And of course, Commute Seattle will email you the recording and a copy of the presentation after the event. Thank you again for taking the time to come here on this hot Monday morning. For those of you unfamiliar with Commute Seattle, we're a nonprofit transportation management association. We serve as this central hub of information for the organizations you see here. We work with properties and companies all throughout Seattle on their commute and transportation programs, also making sure they meet their commute trip reduction law requirements. Next. Here is a look at our program for today. Thank you again to our speakers for your time and your brain power on this Monday. And I'll tell you folks a little bit more about them in just a moment. After their presentation, I will go on to talk about some strategies to consider and communication tools, whether you're developing a commute program with leadership or communicating directly with employees. So with that, I am very excited to introduce our first speaker. Andrew Bata is currently the head of the International Association of Public Transport, otherwise known as UITP. UITP plays a critical role in advancing and developing public transportation policies internationally. Prior to his current position, Andrew graduated from Northwestern and would eventually become the senior director of service planning for MTA New York City Transportation or Transit, and before becoming its chief officer. So Andrew, it's all yours.
Hello, everybody. Can you hear me? Okay. It's a pleasure to be here and talk to you from also hot New York, but not as hot as Seattle. Well, obviously, my entire career was in public transportation, both in the public sector and private consulting before. So it's very important to me as a subject. And I'm a passionate supporter of public transit. And I think this pandemic we've been through has gave us a lot of pause for thinking about what's next. I hate to use the word, back to normal or what's the new normal or whatever. It's going to be different, okay, for sure. The key thing in my mind is that we have to think, why did people in the first place use public transportation, okay? That's what was the first reason they did that. I mean, basically it was, in my mind, to avoid congestion and the stress of driving. Many people know that probably the second unsafest things you can do to your life is driving. First being tripping in the bathroom, I understand. That statistically, I think that's the unsafest thing. That's you're in danger every day with that, okay? But the driving is unsafe. And it's not just unsafe for you, but it's unsafe for society and the pedestrians. So, and again, I'm convinced, and UITP is convinced, that driving, I mean, it's a fact that driving is just much more expensive and cumbersome. And in many cases, and this is something I know that people don't understand it, it's not really door to door. I mean, generally when you drive someplace, you go to a parking lot or a garage or something. I mean, only in the movies you see somebody going to the front door, right? You see in the old movies, people drive up to a restaurant, park in the front, go into the restaurant. I mean, come on. Now, I don't have a car. I haven't had a car for 30 years. I live in New York City. I love the lifestyle. Recently, I was on a trip and I had a car, and every single garage I went into was like a disgusting environment. And I said to myself, I mean, it's unsafe, it's dirty, it's dark, you have to go around looking for a spot. I said to myself, I mean, taking a bus or a train is compared to that to me is so much more, but maybe I'm alone. But I mean, UITP certainly feels that the public transportation option is better. Now, the key thing in my mind also with public transportation is that you can do while you're traveling on public transportation stuff that you want to do. You can go on your iPhone, you can go on your mobile. And I mean, people want to do that. You cannot do that while driving. But of course, people do. And it's scary. I mean, I've seen people talking on the phone and doing makeup and driving, okay, at the same time. I mean, to me, that's it. Now, you can do that in the bus. Absolutely. On a train, no problem. Okay. So, this whole idea of using the transportation mode and it allows you to do other things that you are used to in your personal life, I think it's a great benefit of public transit. Now, the big shock we got now last year was this whole idea of public transit is a shared thing, okay? So this whole idea about shared means closeness. And of course, CDC and everybody said that, riding on a bus or train is dangerous and all that. I have to say, and UITP, we did a worldwide investigation. Talking about worldwide, we have 1,800 members worldwide. There's absolutely no evidence that touching something on a train or whatever transmitted any of the virus. And yes, you are close in a bus or train, but you're also close in the CVS or in the restaurant or wherever you're going, you're close with other people. I mean, frankly, I go to my local supermarket or local CVS or pharmacy. I sometimes feel much more crowded than being on a train or a bus, okay? So having said all that, public transit, I think, has a challenge of keeping the distances a little bit more sparse, and that's a development I think is going to stay with us. But still, I think the benefits I mentioned, the other benefits, certainly outweigh the just the stress and inconvenience of driving. I mean, being stuck in traffic. One time, I asked some people, have a stopwatch and clock the time every time the car is not moving when you're driving, either a traffic light or you're stuck in traffic or whatever, and you will see that the times added for your trip is significant. It could be like 15, 20 minutes, because your vehicle is stopped or congestion or whatever. So, um, so now the whole idea is how to get people back to transit. So I think in many ways it's going to be a natural comeback because it's going to be like a tipping point where some people are going to say, look, I've tried the driving, and they're going to come to the same realization before, wait a minute, this thing is just too slow, too stressful, too expensive, too frustrating. I don't like the garage, looking for space. And because that was the original reason why people went to transit. So I think there will be a substantial number of people who will self-realize that this is not the right mode. Now, of course, there will always be people out there who say, I don't care about how long it takes me, how expensive. I want to have my space in a car. And look, let's be frank, car has certain creature comforts. It's a soft seat with the music on. You can take your shoes off, whatever, you know what I mean? Whatever, you can talk to yourself if you want to. So certainly it has these psychological benefits of privacy. But I think as congestion will increase and the frustration will increase, the original benefits of transit will come to people's mind, and I think will come back. Now, I think the destination people, like the hospitals or employers, I think should have a role in bringing back customers. For example, I'm not sure if you know, in Japan, all employers required by national law to pay for their employees' public transportation cost, regardless of where you live. What do we do in the US? There's free parking. Okay. Now, if you're not gonna pay for public transportation, and people give free parking, okay, that's a negative. Okay. So I mean, I think employers should, if they're in this mode of urging people to take public transport, should come up with some kind of creative plans that, gee, if you don't use your parking lot, okay, if you don't, maybe you'll get, I don't know, $20 extra a week, pay, or some incentive, okay? You get some kind of recognition that you are an environmentally friendly soul, so recognize the fact that you chose not to drive. I mean, I think especially in the West Coast, I have good friends in King County Metro, and I know Kevin Desmond personally. He was a former head; he's a friend of mine. Um, I think that your culture out in Northwest is very pro-environment and progressive, and I think this mindset out there should help your situation there. Um, um, Definitely. Public transit needs to create more creature comforts, I think. One thing that I personally was involved in when I was at MTA is I really strongly believe on two things that are important in public transit. Number one, how good the stations look or the bus stops. That's your first place where the system shakes hands with the customers. Okay, if you go to like a lousy station or a bus stop that has no information, or it's like in the bad spot or no shelter, people are going to say, I don't want to stand in the rain. Yeah, a lot of rain out there, right? So people don't want to stand in the rain. So I think rain is also a big factor. So if I be in the Seattle transportation, I would make sure that each bus stop has a good shelter for rain. Okay. Also, the second thing is nowadays people want to know information instantly. Service. Where is my bus? Where is my train? Has to be reliable. It cannot be like based on schedule. Forget based on schedule. It has to be real-time tracking of information. People want, I mean, look, you can Google right now, what's the most popular dish in Iceland, right? You get the answer in 1 second. So why can't you find out when the bus is coming or train is coming, okay? The second element of that, which is increasing worldwide, and it's coming, and I think you should think about that, people want to know how crowded that vehicle is. Like for example, in New York City, MTA here is putting in a program where it shows the train is coming in 2 minutes, and then it's going to show the, the, the consist of the trains, 8 cars, and it's going to say car number 7 is like yellow, like not crowded. Car number 5, red, crowded. Car number 9, green. People love that. So when people, before they board, they could, orient themselves in a station where they want to board. For buses, it's more complicated because buses only have one thing, but maybe what you can do is have more frequent bus service, maybe smaller vehicles, and then people can say, well, looks like the first one is crowded, I'll take the second one. But of course, for that, you need to have frequent schedules. Okay. Some European companies now, what they're doing, which is interesting, is instead of providing service based on the actual demand, they adding service so that there's more space. You see what I mean? So they're providing more trains and buses, more frequency, so that so the same amount of people can disperse themselves for more service. So that's a big benefit. So instead of like a train every half an hour or whatever, they say, okay, it's a train every 15 minutes or whatever. Of course, in Paris, you have a train every 4 minutes. So that's the idea, to provide the service frequently, and then people say, I can skip taking this bus or this train because it looks like it's crowded, not comfortable. Okay. And also, I think, I mean, many employers or whoever should broadcast the real cost of owning a car. I mean, and a lot of people gave up a car, families gave up a car when they took public transit, and now it looks like some of them had to get a second car, okay, just for that commute to the office or whatever. So owning a car, I mean, I myself, I would say I probably save $10,000 a year. I would say at least. Um, so it's expensive. Gas is expensive. It's not good for the environment. Um, so I mean, that's what I think public transportation should be doing it. Now, UITP for our members only. I'll give you a hint. We issue a weekly tracking of worldwide transit ridership. Tracking it city by city. We have something like 50 cities we are tracking. We're getting the information directly from them. These are member cities. And we see a slow increase, people coming back. It's in different degrees. For example, we're back in China, Japan, Taipei, Hong Kong, Singapore, where they have very strong central governments. Ridership is almost back up to like 80, 90%. Okay, I think in Taipei is almost 100%. Okay. In countries like Brazil, which is like a horrible government and the whole thing is out of control, people just are afraid of everything. It's like done 20%, so just because people are just afraid. Okay. But in most cities now, which includes New York and Chicago, for example, big cities in Europe, I would say the return to ridership is between now 40 and 70%. In New York now, the subway is about 60%. You're talking about 4 million people a day, okay, versus like 6 million before, okay. So because what people have discovered, like in this big city, that driving is just crazy. I mean, you're not driving, you're stopping, okay. I mean, you have your radio and you have your soft seat, but you're not going anywhere, okay. So I mean, that's a tipping point when people will realize, get back to that original decision point of giving up the car. Okay. Now, driving also, I mean, also taking public transit, my personal view, it's healthy because you got to walk a little bit. Walk. Everybody says you got to walk. I mean, we have an obesity problem in this country. I mean, give me a break. People. Walking from your couch to the car, it's not walking. you know. So I always liked, when I was working at MTA, I always liked taking the subway. And then I took 5 minutes or 10 minutes to walk home from there. And then from the stop, I walked to the office 10 minutes. It was like a nice psychological change. I could get a coffee. I can go into a bookstore. I mean, I enjoyed it, So I think people do enjoy that. So I sound like a preacher, but I think it's important also for the association you're with and employers to not to give up on this. Where we want you back in the office, get in your car. You say we want you back in the office, but there's a healthy way of doing it. Good for society, good for energy, good for environmental sustainability. It's part of the. It's not just a commute. The bigger picture.
Agreed. Agreed. Thank you, Andrew. Especially on the part where, I also believe live information is going to be key. We're not quite there yet, but for folks in the audience, we will link you to a few online resources and dashboards that updates that will provide daily ridership in a few counties in Washington State, as well as route updates as well. Andrew, thank you so much for
Sure,
that.
of course. Absolutely.
Yeah.
My pleasure. My pleasure.
Yeah, it's going to be a challenge, but we can do it. We have the
You can do it. Absolutely. Nothing is easy in life.
Right. Our next speaker, folks, it's my pleasure to introduce her, Ms. Camila, who is currently the manager of transportation, parking, and commuting services for Swedish Hospital. As you can imagine, her work is cut out for her during the pandemic, supporting non-clinical operation, daily logistics, making sure our essential workers feel supported as well, and especially now as we recover. So Camila, it's all yours.
Thank you, Serena, and thank you for inviting me. It's my pleasure to kind of give an insight of what has been happening within Swedish that maybe other employers can use. And then, so basically, when this pandemic started, our focus for the non-clinical folks were like, well, what can we do to relieve the stress and the hurdles that our caregivers who are serving our community can do their jobs. So basically, we look into a lot of things, and transportation is one of those big components as to like, this is going to make or break any caregiver's rest of the day, how they're going to get to work, what state of mind they're in. So we wanted to make sure that they were feeling supported. So pre-pandemic, Swedish has a lot of transportation benefits that are offered to their caregivers and some affiliates, because we do have a lot of other folks that come from Providence or contract agencies or different med staff services. So we already offer subsidized Orca bus pass. We offer subsidized ferry passes. We do almost free van pool parking, and carpool parking is also free. Carpooling is free. So we try to encourage people to adopt those other transportation methods. We do have parking, but it's paid parking. You have to pay for it. And we change how much we charge depending on the time you come to work. So we had that already established pre-pandemic. Of course, pandemic came and everything kind of like went haywire. One of the first changes that we did was we were not going to charge for Orca bus passes, and we were not going to charge also for parking, which we noticed that a lot of the transit routes that were coming to the hospital either got canceled or were running less often. So basically, we were having information from caregivers that were not able to get to work, and that's why the benefit of free parking was provided for them. Of course, when you give something up for free, it's really, really hard to take it back. We have since then, we did that for about a year from March to March. And after that, we've gone back to charging for parking and also providing all of those same benefits. The only thing that we are basing our people coming back and paying for parking, all those things, are how's KCM, King County Metro, how are their bus routes, are those also coming back? And then we've also made all of our decisions based on what the CDC guidelines were at the time of, those have changed quite a lot. We have changed our visitor policy, and then all of our decisions basically are based on what our own healthcare team is telling us, and also what KCM is doing. By the majority, I would say KCM, because we also rely on what Sound Transit and all the other agencies are doing, community transit, what they're doing, because we have like 7 large campuses that are located in different counties. So we have to make sure that we're paying attention to those. So yeah, we did a lot through the pandemic. We're still working on trying to offer more benefits to people. We just did a partnership with Fix, offering bike tune-ups for our caregivers on our Caregiver Appreciation Week, and we're gonna do that throughout the year. Basically, caregivers get 1 bike tune-up per year that is subsidized by Swedish. And we're trying to make our biking facilities a lot better. So similar to what Andrew was saying about the buses, like for us to invite people to bike, we need to make our facilities a lot better. So the good surprise last week was that I noticed that our biking community is a lot bigger than I expected. I'm not a biker myself, just because I'm not, but I've learned so much about bikes to the point that I now want to go get a bike. So really excited about that. And then, yeah, so a lot of changes with the pandemic. At the end of the day, we have kind of like, I take care of my caregivers just like they take care of our patients. They are that important to me, and I have to make sure that they feel supported, that they feel like they have a team that is on their, on with them, going to bat for them, doing things for them, so that they can come to work and, provide the best service that we can provide to our community.
Agreed, Camila. I can imagine. So I know Swedish has such a robust van pool program. Can you talk a little bit about,
So we have about, I want to say that we have about 30 or 40 van pools right now, that they come from like different areas of the Greater Seattle area, and then they come as far from Tacoma, and then we have one coming all the way up from the north side. For people that do van pools, It is basically paid by their Orca card. They have to have an Orca card to get into the van pool. They get, the van pools get a primary stall at our garages. And they also get caregivers that for some reason, let's say that the van pool left early or the van pool didn't come or something happened, we do offer about 4 free days of parking on a month. This is a validation process that we have. And this is just in the case that something happens. But along with that, for people that do van pools and carpools, they have a guarantee at home. Basically, if they have to go back home, we also provide them with, I think we have 8 of those per fiscal year. Our van pools go to different places. They also are shared sometimes with other organizations such as Harborview or Virginia Mason. We have 2 ways in which we set up people for van pool. One is that we use our caregiver Commute portal, which is powered by Loom. They help us do a lot of the matching process that goes in it. It's a very good tool for people to connect with each other without having for us to do a manually connection within van pools. The other place where people go to get information about van pools are Rideshare Online, which is super helpful for us. And then when we're not able to find people either with our caregiver Commute portal or Rideshare Online, then we start gathering information so that if we see that people are coming from a similar zip codes, we start connecting them. We don't share any personal information. At the most would be a zip code or a neighborhood, and we ask for permission before we even do those because we have to make sure that they're comfortable doing that. And then through the pandemic, I think that the minimum required went from 5 members of a van pool to 2 members of a van pool, which I think helped a lot of our van pools not dissolve. We thought that we were going to be 0 van pools, that people are not going to feel comfortable, but we figured out that we didn't have that many van pools dismantling. And basically, when we went and talked to other people, it's like, why? Just out of curiosity, not that I want you to dissolve it, but like why? And then a lot of it was, these were groups of people that have been van pooling for a while, and they trusted each other to be safe. And, the majority are healthcare workers that knew how to stay safe. But we grabbed a lot of information from the King County Metro's website on how to stay safe. And we make sure that that message was passed on. We make sure that what King County Metro was saying was actually, what we should be saying as well. And then we check with our own healthcare team, be like, hey, is this okay? And they say yes. And so that's how we were able to, and if people didn't feel comfortable staying on a van, those were the people that we provided free parking for, which have then gone back to their vans, which is great. And then that's what we did for van pool. We also were looking into options for people that are coming from West Seattle, because the bridge and the pandemic, they kind of happened at the same time. So we have a really good relationship with King County Metro and how they do their vans. And we work on different ways that we could get people off of the West Seattle Peninsula into our hospital. We have to keep in mind that at that time, I think a lot of what was happening where like policies were being built as who was going to be allowed on the low bridge. And I am very thankful for the people that are in the city of Seattle managing that project, because they answer to all of my emails, all of my questions and concerns. And I'm an advocate for my caregivers and anybody that is in healthcare. So I was like, I need to get my providers and my healthcare workers and everybody within 30 minutes, because this is a life or death situation. They need to be able to pass. So van pool was one of those options before any other policies were put in place for people going on an SOV line on the bridge. So van pools, I love them. I've been trying to get into one myself. Where I live, it's kind of hard. So it's kind of hard to find, but there are options. If I was more flexible with my schedule, I probably would be, everybody can do it. It's just a matter of like, how much are you willing to give and to like change in different routes. And I think that when we show people, this is how much you would pay for parking a month, and this is how much you would basically not pay for a van pool. At the end of the day, money, it's one of the factors that move people. And we want to make sure that we're making all these benefits very obtainable to caregivers so that they can use those instead of, paying for parking, which in our case, while the pandemic was happening, we had a lot of policies that were changed as far as visitors. So our garages did have space, but now that our patients were coming back, there's less space. And you want to make sure that you have the space for the patients and at the same time for your caregivers. So it's a very, very interesting fine line because, who do you serve, patients or caregivers? And we have to serve both. There's just no preference. So yeah, that's the example. And just to go a little bit more into like rideshare, we did a lot with carpool. We partner with Scoop and Loom, and having those big partnership for us was really important because people were able to carpool with people that they know, that they're trusted. And then Scoop was able to share with us, how do you carpool safely? And basically making sure that, that you all, know the person who was carpooling with you. Also, to keep everything clean and where to sit, and in the car, where to sit. Like it was like things like that, help us. I know that Scoop stopped their three-way matching, so you can only match with one person, not three. So they did a lot of those changes, which we also took back to our leaders, and we asked like, hey, how is this okay? Because they know more than I will ever know about anything. So yeah, it's those two methods, vanpool and carpools, I think that were pretty successful through the pandemic, even with the pandemic going on, which I was really happy for. We did had a lot of people driving, which now we're having to like take back to the bus. And I think that something that I heard is like, we need to have this, like, how do you commute with confidence? Like, how do you do this? And one of the ways that we've done this is like, we need our leaders to be the example. We have a lot of our leaders within Swedish riding the bus and telling their own experience and saying, yes, it is safe. So people trust them because our leaders here at Swedish are people that they're I don't know how to explain it, but it's like they're very approachable, they're very kind, they're very smart, they're all those things that a leader needs to be. So people follow their instructions and their guidelines. So I'm very thankful for the leadership that I have in my organization. And I would say that if you're having issues with, pushing your community or your employees to take the bus, it's like, maybe ask one of your leaders to take the bus and then to speak from experience. So yeah.
That makes a lot of sense, Camila. And you talked about a lot of the things that I'm going to touch on here in a moment. But before I move on, just thank you again. I think that's extremely helpful. Now we have a few healthcare providers here today, just wondering, how did others manage commute programs during this time of immense difficulties? So thank you. I am going to move on by sharing my screen. Okay, so I'll go through this pretty quickly since we have about 12 minutes here. What you see here is how employees were getting to and from downtown before the pandemic hit. Some of you might have seen this before, and I'm not going to go into details about every single service and mode that's available in Seattle, but we will link you to a resource that'll provide all those updates in our OneStop Shop on our website. What I want to focus on is the big picture with this graph. As you can see, the drive alone rate is visually half of the amount of employees taking transit before the pandemic. If you haven't already, I encourage you to look at how employees were getting to your work site before the pandemic, and not only strive to hit that goal again, but think about the ways you can improve and evolve really. And some other things to consider when thinking about your commute program. First, I'd say, does your organization have a sustainability goal? If it doesn't, how could you support Washington State's sustainability goal? Currently, motor vehicles are the #1 contributor to air pollution. In 2017, transportation produced 29% of air pollution in the United States, and we can compare that to the 15 to 20% it contributes to globally. For us, every May, greenhouse gas emissions are at its very peak. So this is right before nature is in full bloom, ready to inhale all those toxins and release that fresh air us Pacific Northwesterns tend to love and enjoy. Well, now, because the rate that greenhouse emissions are being produced is faster than ever, nature can't keep up. NASA will tell you that this is leading to more wildfires. The photo you see here is from last summer, taken by the Seattle Times. And if we weren't wearing masks for a pandemic, we sure had to wear masks because we were hitting with all that smoke from fires surrounding us from everywhere at one point. There's also the increase of greenhouse emissions also leads to longer periods of drought and more devastating storms worldwide. One example I'd like to share with you all is with Expedia Group, who was able to build out such a robust transportation program that they avoided 1 million pounds of greenhouse gases in January and February of 2020. 1 million pounds sounds like a lot, but I would like to further share some perspective with you all. So the average Washington state commuter travels just over 20 miles from their front door to the work site. But as Andrew mentioned, that's not always the case, right? It's not A to B. However, using this example, that is roughly traveling from Federal Way to downtown or Montlake Terrace to downtown Seattle. Now, thinking about your organizational impact, if 100 employees drove to work, that's over 21,000 vehicle miles traveled that week. According to the United States Environmental Protection Agency, those 100 employees would have consumed 860 gallons of gas, which the emissions burned from that 160 gallons of gas was as if we burned over 8,000 pounds of coal or used over 300 propane cylinders for home barbecues. And as if we were to take over 900,000 dead smartphones and fully recharge those. I don't know about you, but those don't sound like anything I would like to be breathing in. And just a little food for thought for you all. Next, this is something Camila also touched on, considering parking, moving from monthly parking to daily parking. This is something Commute Seattle has advocated for long before the pandemic. Going back to my Expedia example, what you see here are the policies they put in place to dramatically decrease their driver loan rate every few years by increasing parking rates, moving to daily parking. And what that does is, in monthly parking, we think, we want to get the best bang for our buck. How can we get the best value since we already paid for this? We're committed to monthly parking, but moving to daily parking allows us to ask ourselves if we really need to drive that day. Another great example is Seattle Children's Hospital, who implemented similar parking policies. They went from, I think, a 73% driver loan rate in 95, brought it all the way down to 12% in 2017, even further down to 7% by 2019. The one thing I want to mention is these parking policy changes were coupled with incentives, again, like Camila mentioned, to bike, to walk, to what have you, scooter, to further incentivize this switch to active commuting. So how else can we encourage this behavior? We could leverage the fresh start effect. I'm no behavioral scientist, but this is a proven technique that, we all use every day. How many of us have set a New Year's resolution or had a rough week and told ourselves on Monday, we're going to start new, we're going to work harder? So components of leveraging a fresh start. First is thinking about your employees' goals and aspirational behaviors. The example I have here is the goal is to commute on transit 5 times a day. So why not start with having employees commute maybe once or twice, the goal is to commute on transit 5 times per week. So why not start with commuting on transit 1 to 2 times per week, maybe for 30 days or 6 weeks? the goal is to ease into this behavior. Also thinking about motivations and how the company can help. Now, motivation isn't a one size fits all. There's health, financial reasons. Maybe someone just doesn't know where to go, what station to go to, how to ride the bus. So the company can maybe implement, I don't know, a walking competition, a free consultation where we can sit there and help you route your commute. And lastly, let's highlight a new beginning in our messaging. I think most common in business will, at the end of Q1, let's say, we'll receive an email stating something like, oh, at the end of Q1, we're short 6% of our profit goals. But hey, Q2 is starting. We need to do A, B, and C to make sure we reach these goals. Maybe in your messaging, you want to include some data. As I talk about the next few online resources, we'll be sure to link them to you in the chat. This first one is a Washington State Department of Transportation dashboard that provides you daily ridership information. Now, it's not as live as New York City's, but this gives you nice insight on trends as well. We also have the King County Metro Rider dashboard. This provides you information about, yes, ridership, also capacity, the number of trips, missed stops, also mask compliance. The idea is, to empower your employees or you and your leadership to encourage active commuting on transit. We also have a OneStop Shop page, which I mentioned earlier. Here you can find transit updates on which routes are suspended, updated, rerouted, also information about light rail openings like at Northgate coming in October 2nd. We also link you to some bike resources or the scooter and bike services available in Seattle. Also linking you to transit updates for surrounding counties, Kitsap County, Community Transit, Pierce County, just to name a few. We'd also like to invite you to this employer roundtable that Commute Seattle partnered with surrounding transportation agencies with. This is an opportunity to sit down and just learn and discuss, sharing ideas with other employers about how you are going to kickstart your commute programs or some strategies you're thinking about promoting. The last thing, before I move on, I wanted to point out that yes, state highway traffic is within 90% of pre-pandemic levels. This is as of May, probably more so now for those of us traveling on I-5 through Soto or South Lake Union. Freeway traffic is at pre-pandemic levels. So another thing to consider. And last but not least, again, as a friendly reminder, your staff traveling to and from West Seattle is going to need a little extra love and care, since that high bridge will be closed until well into next year, I believe summer of next year. Now, transit vehicles, employer shuttles are currently eligible to take the low bridge, but if you're not authorized, you are subject to a $75 citation. Select groups can also apply for access, such as West Seattle businesses or on-call health workers. And if you're needing to create a mitigation plan or would love to talk about some options that fits your specific needs, please feel free to reach out to Commute Seattle, and we'd be happy to sit down and talk about your options to help avoid that extra hour of commute time that people are facing for the next year. Lastly, before we jump into the Q&A, I'd like to announce that one lucky attendant here is going to win a $50 Visa gift card, and as well as some transit merchandise from Transportation Choices Coalition as a token of our appreciation for your time. All right, and with that, with 1 minute left, I'm going to jump into the question. Looks like we got one here. One reason that it has been difficult to get back on the bus is that people's regular bus routes are still suspended. Yes. It seems that King County Metro is waiting for the people to come back before they add back routes. And the people are waiting for King County Metro to add back routes before they come back. Is Metro willing to take a leap of faith and bring all the routes back to get us out of this cycle of stagnation? Answer is yes. Now, we're going to see routes slowly return and ramp up, but it will be, the routes will return in September on a larger scale, since September or the service changes happen every year. That Commute Seattle webpage I linked you to earlier will show you live updates, or I should say current updates of which routes are being reinstated and suspended as they come back. Whew. And we're at time, but just one more minute in case anyone has any further questions. You're welcome to email us at ctr@commuteseattle.com, and we'd be happy to sit down with you. Yes. Her face mask unplugged. Yes, well, for now, I do know the mandate applies to us currently. I'm not sure how they'll change it based on capacity just yet. And more links. All right. Well, as we learn more, because Washington State reopens on June 30th, I encourage you all to keep update. We have our weekly newsletter that we send out with transit updates. I encourage you to look at all these resources we sent you. There's a lot of great data you can include, maybe to present to leadership, again, to employees. And lastly, thank you so much again to Camila and Andrew for joining us on this hot Monday. I hope you all can stay cool and have a great Monday. All right. Thank you, everyone.
Thanks, Serena. Bye, everybody.
All right.